A good day to me is when you're able to take care of patients and at the end of the day, people are up and walking around and they haven't been able to move without pain in years.
Everything aligns when a patient who's had issues comes back to the office and even within 2 to 3 weeks afterwards says, my life has changed.
Someone comes in, they have a painful joint, they can barely get around, they can't do stairs, they can't play with their grandchildren. Then 6 weeks later, their life has changed because of something you did. There's very few other jobs that allow you that degree of happiness.
We're, like many facilities around the country, are building a facility so that the patients in Central New York who are healthy don't have to go to the hospital to get a hip or knee replacement. They can come to an outpatient surgery center. They can stay overnight if necessary, and they can comfortably go home, after that short stay.
Surgeons can deliver care at much lower risk to the patients.
You're more active, more mobile, so there's less risk of getting a blood clot. And there's less risk of getting an infection because you're not in the facility for an extended period of time.
So in order to house that effectively, we had to have a center that is state-of-the-art.
And I think having a facility like that reduces patients' risks and increases their expectations and optimizes their outcomes.
When they're happy and they're done and they give you a hug or a handshake because their life is better.
It's a very satisfying career for me, and I would have done nothing else.
I think I have the coolest occupation of anybody.
Just bringing hope and happiness and relief of pain to a million different people.
That's the most satisfying thing that we do.
Can't beat that.